Hello and welcome, everybody. Thank you so much for attending the Multi-State Licensure and Telehealth for Mental Health Practitioners, featuring Dr. Elizabeth Stanton. I'm your host, Andrea Camp, Sales Manager with Therapy Sites, and we specialize in websites and online marketing solutions for mental health professionals. I'd like to personally welcome each and every one of you to this free educational event. We are really excited to be here with all of you today and to welcome our guest speaker, Dr. Elizabeth Stanton. Dr. Elizabeth Stanton is a licensed psychologist. She graduated from San Diego State University with a BA in English and Psychology, Wesleyan University MA Psychology, and Southern California Seminary MA in Clinical Psychology. During the last 12 years, Dr. Stanton has worked to promote accessible, quality learning and student success in higher education. Her roles have included Vice President for Academics, Department Chair, Associate Professor, WSCUC Accreditation, Liaison Officer, and Supervisor for Student Life, Campus Services, and Campus Government Relations. She participates in community efforts to address violence and other areas of collective concern. Currently, she has a private practice in San Diego that supports the needs of individuals, couples, and families. She also serves as an instructor, coach, and content developer for Triad. During today's session, Dr. Stanton is going to ask some questions to all of you, and we'd love for you to participate. So if you want to take a look at the GoToWebinar control panel, there you'll see a questions tab. Feel free to use this tab to answer any questions, ask any of your own questions, and make any comments that you may have along the way. A recording of the session will also be available to all of our registrants. After the webinar has been concluded, we do have a quick survey, and we'd love to hear your feedback. So now that I've gotten all of that taken care of, let's meet our presenter, Dr. Elizabeth Stanton. Take it away, Dr. Stanton.
Oh, thank you so much. Good morning and good afternoon for some of you. I'm really happy to be here and excited to discuss multi-state licensing and telehealth with you today. I have lots of information to share, so I'm going to jump on in. Thank you for the introduction, and I will also want to just tell you a little bit about Triad.
I think we lost audio, Dr. Stanton. Do you want to just make sure you click that audio button for me one more time?
Oh, there we go. I'm sorry. I think I hit. Anyway, let me start over then because you didn't.
Thank you. Thank you.
Yes, thank you. I'm sorry about that. So I was thanking you for the introduction and said I wanted to also introduce a little bit about Triad. Triad provides education, community, and career resources to behavioral and mental health professionals, institutions, organizations, and employers. We have over 45 years of experience supporting behavioral and mental health professionals. So we're super excited today to broaden our community through our partnership with Therapy Sites to help you navigate the world of multi-state licensing and telehealth. Now, what we're going to discuss today is a little bit about the benefits of multi-state licensing and some of the requirements to keep in mind when it comes to courses, and we'll get into that. And then the idea of license portability. We'll discuss a little bit about the area of psychology in terms of psychologists, also MFTs, the area of social work, and then counseling, because each have a little bit of nuance to the license portability. And then we'll talk about telehealth and multi-state licensing and sort of the relationship between the two that can really help to expand your practice, so to speak, but also your impact. And then, as mentioned, there'll be some additional resources and time for questions as well. Now, a question that I do have for you all, just to get an idea of who's here. Like I said, we're going to talk about a few different areas in the field of mental health. So I wonder, do we have MFTs in the world out there in our webinar, any psychologists, social work? So maybe give us a little bit of an idea of who's in the audience today. I'm going to discuss a lot about psychology and the psychologist experience in terms of the multi-state licensing. But again, much of this applies no matter where we are in terms of the field. Now, I don't have an opportunity to see these answers, but can anyone tell me what is it looking like?
A lot of licensed social workers. We have a couple of psychologists. We have a licensed counselor. We have an LPCC. We have several LMFTs. lots of lots of short.
Okay, that's great. And it sounds like we have, the wide variety of the different areas that we'll talk about. So welcome, everyone, and glad to have you here. Now, again, if I don't cover something that is your field, don't blame us. We'll get to that another time. All right. So as we're getting into this idea of multi-state licensing, I want to make sure that you are thoughtful of the Association of State and Provincial Psychology Boards, right? Better known as the ASPPB. And the reason is because the ASPPB, for psychologists especially, is the housing of all of our information when it comes to academics. And at some point, this may be something that you go back to when it comes to the multi-state licensing component, in terms of having access to, or giving different states access to your testing information, et cetera. But then also we'll talk a little bit later about the certificate for professional qualification that will also bring you back to the ASPPB. Now, also when we think about multi-state licensing, it's maybe helpful if you have sort of an entrepreneurial mindset about this, and not so much about a money or monetary aspect. Of course, that's always, in the picture, but more so that you get to do the most good for the most people. When I think about being able to work in a variety of different states, or the benefit of that, essentially, being able to work with some certain area or certain group, maybe that's not available to you where you are now, but it would be if you had access to another state. So again, when we also consider the shortage of mental health professionals in some other states, some have a wealth of mental health professionals, but other states have a pretty scarce amount. And so those are things to consider as well when we think about the benefits of multi-state licensing. So again, it's going to allow you to practice in new states when relocating, right? That's a given. And also when we think about what sort of happened during the COVID pandemic, that required mental health professionals to be able to access different states. And I think we became more aware of the need to have that portability that we'll discuss in a moment. Now, another benefit is that you're able to treat people in various places via telehealth. So depending, again, on the nuances of where you're located and your ability to be licensed in other states or practice in what we'll also discuss soon as PsyPACs, there's a way that you can, again, treat a wide variety of people. It will extend, your client base, but then also if you're, again, wanting to work with a particular group, or maybe you're really interested in a certain type of disorder and you just don't have access to that, it allows you to be able to really increase that. And of course, it increases public access to mental health care. And when we think about the multi-state licensing process, there is this minimum standard of practice that we are going to make sure that folks have access to care, but then also that those who are a part of this are all held to a standard to protect the public. Some of the things that you want to consider when it comes to multi-state licensing is the malpractice and disciplinary actions in different states. Just being aware of, in terms of ethics and what those rules are. And then also keeping in mind that every state has a different requirement for your CEUs, right? So if you're licensed in more than one state, to keep in mind, that it may not be the same across the board, and making sure that you're prepared for those renewals as they may come. Also thinking about the costs, right? So there's renewal costs when it comes to licensure, and we know that given the licenses we have now, but then, considering that there may be an additional cost as you increase your licenses in different states. And then also thinking about the benefit of having access to a variety of different folks if you're a part of an insurance panel. That gives you, especially not being in the state, maybe a way to interact and connect with folks through maybe an EAP program, or again, just the standard insurance panel. And then thinking about ways that you might market yourself in those other states. Again, maybe you'll use the help of insurance panels or come up with another creative way to make sure that you can build your clientele in that other state. Now, when we think about, again, the difference in these different states and the requirements, my invitation to you is to ask as many questions as possible and not be afraid of sending those emails or reading until you get your answers to make sure that you're clear about what you need to do in each of those states and their requirements. Now, also in thinking of that, right, this is part of the complexity is that difference in the requirements, but then also when we think about the different licensing boards of the various states and how they're also going to have differences in maybe the licensing titles. Not every state lists a clinical psychologist as such, right? It may have a nuance to the title. Even LMFTs, LPCCs, we use those terms frequently, but you'll notice as you start to look through different states, not everyone lists them or titles them the same way. So being thoughtful of that, and then what the scope of practice allows for that particular title, because that may not be the same depending on what state you're in as well, in terms of what we're allowed to do and not. And then also being thoughtful of the exam and education requirements. So depending on the state, they may have a variation in, say, the number of hours that you have to have for your supervised professional experience. And it can range from 1,500 hours to even 4,000, depending on the state. Now, this may matter depending on where you are in your license sort of experience. And I say that because some states will say, if you've been licensed for 5 years, then you don't necessarily have to be concerned with the exam or education requirements. Some states will say you have to be licensed for even like 25 years before you don't have to consider those things. So it just depends. And so you want to just look into it, right? See what the state requires. But if there is a way to sort of have a portability, which we'll talk about in a moment, you may, again, not have to be concerned so much with the exam and education requirements, except for usually there's still, even if there's not an education requirement, there may still be a requirement for the jurisprudence or their ethics exam in that particular state. Now, all this said, the sooner the better to start kind of searching around and considering what states you might even be interested in applying for licensure to see what their requirements are. One note about exam requirements, and again, this is nuanced depending on the state, but some states have adopted the EPPP2. So depending again on what their language and standard is, that may be something to just consider if it's an additional requirement for you to participate as a licensed professional in that state. Now you might say, well, if I'm licensed already, why would I need to go through all of that? And like I said, some states just have it nuanced, and some states are a little bit more practical and will give you more credit for having been licensed already. And then again, sometimes it's nuanced by how long you've been licensed as well. So again, just thinking about some of the differences and being prepared so that you're not ready to make a big move and then find out that there's a requirement that maybe you weren't ready to address at that time. Now, I've mentioned a few different moments here. I've mentioned in a few different times portability. So licensure portability is basically what it sounds like, right? That your license that you earned in one state can be sort of portable, right? It can be ported to another state. When we think about portability, maybe thinking about terms like reciprocity. And again, the idea is that you can take your qualifications for your licensure in one state and apply them to another state without much hassle or to do in order to meet the requirements. Now, one thing that you want to be thoughtful of too is just the jargon. You might look for license portability when you go to a state's board website and it's not there, right? So be thoughtful too of being creative with the way that you're describing what you're looking for. Reciprocity might be there. You also might find licensure or license through endorsement. All pretty much the same things where they're going to give you credit for what you've already done and allow you to sort of seamlessly, I should say, cross over and get licensed in that state. Now, again, like I said, some states have different requirements. And I mentioned with the ASPPB that there is the option for the certificate for professional qualification. The certificate for professional qualification is essentially like a national register that you apply to the ASPPB. And it's an application, but you essentially are presenting yourself. And this is something that you're able to do after you've been licensed for at least 5 years and haven't had any, any type of disciplinary action or anything brought upon you. And then you're able to essentially present yourself to the ASPPB and then get this certificate of professional qualification, which in some states, and actually many states, they will allow that to be used for your portability or your license through endorsement, etc. So there's some other considerations when it comes to being certified in a sense, or if we think about, becoming board certified and one of the various areas that you can do and have that's again, just kind of gives you sort of a credibility that the state may be willing to accept that and not put you through all of the other steps. Now, again, when you're looking for this information, right, and what's required for various states, I do want to note that you want to be really careful to watch out for the non-government websites. I mean, if you just do kind of a search for a state or even, license portability in Oregon or something like that, you might find a website that looks like it's giving you all this information about requirements, etc. But be really careful because you want to make sure that you're making whatever your plans are based on the most, credible website that will give you those requirements, which is probably going to be going to the state board website directly. So I just want to really encourage you to avoid the non-government websites, go to the state board website directly and start to get familiar with it, just like you've done in your own state, to really understand what the language and the jargon that's used, but then also what those requirements are specifically from that state's board, not from some other helpful website. Now, also when we talk about ways to sort of have this portability, I mentioned that there's PsyPact, and this is the Psychology Interjurisdictional Compact, which began to really get some momentum during COVID as well, because it allows there to be like a go-between or a bridge for you to be licensed in one state and then become licensed in another state. But then also there's a part of PsyPact that allows individuals who are a part of the PsyPact agreement. If you're in a state that has agreed to this, then you have the opportunity to do telehealth in a variety of different states. So what's been done is essentially PsyPact has worked with a number of different states in the U.S. to basically ask them to join this agreement, kind of like how our driver's license work, right? Like you can have a license here that allows you to drive in another state without a problem. PsyPact is kind of working along that same idea so that mental health professionals, and in the case of PsyPact, it is psychologists that can participate in this and then be able to, one, like I said, be able to get licensed or move to another state and conduct face-to-face services without much hassle, but then especially being able to do telehealth with a variety of different folks. So I think when I first started doing these webinars, which was a couple of years ago, but not too long ago, there was only about 31 states that participated in PsyPact. And so in preparation for this and reviewing, it's very cool. PsyPact has been able to have now 42 states that are effective in terms of they are actually participating in the compact, and there's 43 that total that are working on it. So, right, so there's still one that's coming, and that's really exciting. So that means that there's only a handful of states that do not participate in the compact. And so if you're licensed in a state, like example in my case, California does not participate in PsyPact for a variety of reasons. And so that would mean that if I'm licensed here only, I can't participate in PsyPact because my state doesn't. However, if I am to become licensed in a state that does participate in the PsyPact or in the compact, then I am able to apply and become a part of it. So that's another nuance to think about the benefit of being licensed in another state, is maybe even just for this capability to participate in PsyPact and then have access to a variety of folks in telehealth. Essentially, participating in PsyPact would give you access to clientele in currently 42 different states. So something else to consider when it comes to what is my sort of future look like in expanding my practice. Again, this doesn't replace multi-state licensing in terms of becoming licensed in another state, right? So just because you're in PsyPact and you're able to participate with these 42 different states, if you were to actually, go there to be licensed in that state, it's a different process. But just something to also think about. If you're wondering, Guam, Puerto Rico, Virgin Islands, Oregon, California, and New Mexico, and lastly, Louisiana, are the states that do not participate in PsyPact. So again, it's not that many, and it gives us options to get licensed somewhere else then and really take advantage of that. Now, there's, like we mentioned, a few different types of organizations that all align with the various licenses that we hold. The AAMFT, or the American Association for Marriage and Family Therapy, this is the professional association for the field of marriage and family therapy. Now, in this case, they mentioned that when it comes to licensure portability, they haven't made it. I don't think there's an official process, but they are in the making of trying to create a way for there to be a more specific and sort of standardized approach to licensure portability. Currently, there's language that say that the qualifications have to be substantially equivalent, right? But that can become really subjective depending on who's determining what that is. So they're working to really standardize an endorsement model so that everyone will have sort of the same expectation in terms of this substantially equivalent piece, and will remove many of the barriers, I would say, that LMFTs encounter, even if they've been licensed for many years in another state. Because of that subjectivity of that substantially equivalent, there can be some issues. So hopefully this will be happening soon. So right now, it still sort of depends on the state on whether or not they will bring over your license, but maybe sooner than later, we'll have a bridge that allows that to happen more easily. Now, also, there's the ASWB, and this is the Association of Social Work Boards, similar to the requirements for psychology, LMFTs, and here with social work. The idea is to have this bridge between jurisdictions, and all three, well, actually all of them that we're over today, make it so that as long as you meet the requirements, or the idea is that if you meet the requirements of the licensing piece and you've had no disciplinary actions against you, then there is opportunity to have this reciprocity experience. Now, when we think about the ASWB, they have definitely worked for several years to help states sort of regulate policies that will promote this type of practice, but also still in the works, right? We're still making this an official thing in order to provide more access to mental health care. So I hate to say that the idea is that eventually we'll get there, but being thoughtful of the language and such that is sort of varied between the different fields. Now, there's also licensure, portability, and counseling. So looking at the ACA, also working to make it so that a counselor who is licensed at the independent practice level in their home state, again, with no disciplinary actions against them, that they're eligible for licensure in any state in the U.S. jurisdiction. And that, I think that would be huge if that is something that is able to be accomplished. Now, there are some concerns when it comes to licensure, portability, and or creating these compacts where folks can treat people in a variety of different states, considering the just even the requirement, the education requirements for, say, the program has to be APA accredited. Some states don't require that as a licensure standard. And so if someone has been, say, they went to a school that wasn't APA accredited, maybe it was APA approved, and then they're trying to apply for an interstate compact that requires that, then many folks may be limited. So I think some of the states that aren't participating, it might be because they have a different sort of mode of licensure that would impact those who have been licensed in that state. But nonetheless, still in the working for those in counseling. And then in addition to that is the National Board for Certified Counselors. And this is, again, a place to look when we're thinking about how can I expand, my licensure to another state or territory. Similar process, going through no disciplinary sanctions. And this is for at least 5 years from the application for endorsement. Some of them are none at all. This at least gives a little bit of wiggle room. And also that the licensee is has the highest level of education, or I'm sorry, the highest level of counselor license that is, again, available probably in that state. So you'll see there, I'm not going to go through all of the requirements, but there are some nuances depending on what area, right? Counseling, LMFT, social work, etc. But the idea is that you're hopefully going to be able to get the information, see that you already meet the requirements, and simply apply for this reciprocity, or some of these, if you're in a state that has the side pact option, if you consider that. Now I'm trying to make sure that we're thoughtful on time here, because I know we want to make room for questions too. With before we get into telehealth, I'm wondering how many of you would use multi-state licensing to benefit your practice? Would you? I guess we could just say me, and we would know if there's a lot of folks who are thinking to do that.
And a lot of positive responses. Me. Yes.
Hopefully this is encouraging, and when we get done with this, you're going to go to the board and figure out, hey, where can I get licensed? And if you're thinking about it, maybe considering like your most neighboring state, and see if there's an option for licensure for you in that way, just to, again, start to slowly but surely expand your practice, or at least be thoughtful of the requirements. I also want to note that some states, in terms of becoming licensed there, will have a requirement for some type of residency, right? Or that you somehow have a residence in the state. So again, that might be something to be nuanced. You might have to rent a room from a family member that lives in the state, or something along those lines, to meet that requirement also. But I'm glad that this is something that you see as a way of benefiting your practice. It can be really, really cool, and I think gratifying as well. So now we come to telehealth. Telehealth is huge nowadays, right? I mean, I've encountered some folks that do telehealth only, right? They don't see people in person at all. So I think it's definitely been something that's grown on us over the last few years. And so some of the stuff that I might go over, you might already know this, and so what, right? Obviously, we want to have informed consent when it comes to telehealth. But since we're talking about telehealth and multi-state licensing, being considerate of, if you are doing telehealth in other states, that your informed consent form is aligned with that state, right, and those requirements for that particular state. And also noting that there are some nuances to the informed consent form that will be, some of the wording may be different, or you may include some specific wording when it comes to telehealth in the informed consent form that might be different from your traditional standard informed consent. Specifically when it comes to the confidentiality piece, but also noting that if you're using telehealth, you would be responsible for that security piece in terms of the platform. So Zoom and other virtual platforms have an option for some of these security certificates that essentially help you ensure confidentiality. But when it comes to working with folks that are engaged with you in telehealth, there's also this idea of making sure that no one's in the room. I don't know if you've had that experience before where all of a sudden you're like mid-session and you realize this person is not alone. Like, wait a minute, what's going on here? Doesn't happen a lot, but every now and then it's like, are you by yourself? And so I think just kind of whether that's a part of the informed consent piece, or even just at the beginning of sessions, just sort of making the statement, right? Like, are you in a room where you are, alone, and that this can be a confidential conversation. So checking that out, but then also considering to transforming your documents into electronic documents, our intake forms and some of the patient information and things like that. And again, since telehealth doesn't seem like it's going away, maybe even taking the time to, do some of those, like how you can make a PDF what do you call it? Where you can fill it out, right? And then actually upload it electronically without having to print it, fill it out, scan it, etc. So some of those options too just make life a little bit easier in this world of telehealth. And then also thinking about how as we grow in telehealth, there is room to maybe consider CEUs, right? Again, this is kind of one of those things where you might be, oh, I can do telehealth. Yes, of course we can, but it is still something new in terms of a service to the field. And so if there's ways to learn more avenues of making it more successful or accessible, and especially when it comes to some of the ethics requirements, we want to stay on top of that. So don't overlook the opportunity for some CEUs for telehealth, especially to make sure that you're in line just ethically, if anything else. Now, when it comes to insurance company requirements as well, just making note that some insurance panels have some requirements or some additional information that they want you to include on some of your clinical notes, etc. And so just thinking about those extra pieces and how that might play a part. And then, of course, when we're doing telehealth, depending on what the payment strategy is, we also want to make sure that we have that squared away to ensure, co-payments and essentially payment for treatment, et cetera, can be done without hassle. Make sure that your folks can pay their portion, but that also you receive, what you're supposed to. Now, I think as we've gone through all of these different pieces, we are almost to the end here. I want to also just note that with the benefits of telehealth, again, when we think about the PsyPact and being multi-state licensed, telehealth is a way to really, really expand your practice and having that, greater clientele capacity. As I mentioned, it allows you to use and maybe even challenge yourself to use different treatment models. Maybe we have to figure out how to do it now electronically rather than in person. You'll know if you haven't already that there's fewer no-shows when it comes to telehealth. And I think that what happens also is not only are there fewer no-shows, but the no-shows aren't as much of an interruption or a problem for me either, because I don't have to be in the office and figure out what to do now. So that helps in just again keeping with that consistency of care, and then also giving folks an ability to participate in therapy in a comfortable setting. I've had some feedback from folks that have felt being able to be in their own home, setting, and being able to not have to worry about where they're going to park or getting there, right on time so that they can make it to the office. That helps to really just set a different tone for the session itself. So those are all some things to consider when we think about the benefits of telehealth. And as I mentioned, I think the biggest part of it is to think about the expansion of how you can treat folks, right? The expansion of treatment, I guess, is what we can say, and that we're able to do the most good for the most people. And some states, like I said, have a real shortage of mental health professionals, and that could be a place to start when you're thinking about multi-state licensing and where you might want to be licensed to do some telehealth. Could be in one of those places where they have a great need for folks to be able to step in and fill that gap. And so all of this would mean that doing some research, right, taking your time to really think about what this looks like for you in terms of multi-state licensing. Will you have access to PsyPact or looking into the various boards when it comes to social work and counseling to see what the options are and if the process is maybe a lot easier than you might think, and just getting an idea of that so that you can start making a plan of where you want to sort of expand your practice. And then also noting that we have the opportunity to be able to sort of speak into some of this legislature and things like that as well. So looking at your state and seeing maybe where they are and some of this process for the reciprocity piece and the bridging between states, and perhaps there's some impact that you can make at that level as well, and just seeing what's happening and where you're located. But on that note, I think we have made it through all of our information, and so we have some time now for some
Perfect.
questions and just
Perfect,
see if
perfect, perfect. Yay. Thank you so much, Dr. Stanton. Take a drink, breathe. That was so
yes.
much to cover. What a great presentation. Honestly, every presentation that you do, I always take down different notes and I like learn something new. So it was a great presentation, and I learned something new from the session. You shared so much valuable information about multi-state licensure and telehealth. You know, at Therapy Sites here, we work with mental health professionals to help them create a professional-looking website and ensure they can be found online where and when their clients are searching in order to help increase new client acquisition. We encourage the practices that we work with to build a website that's a reflection of themselves, but also to help them create a marketing strategy that allows them to achieve their goals. Our solutions make it easy to schedule appointments online, create a network of referrals via social media, and even the ability to interact with clients from virtually anywhere from our telehealth platform. So, as a special thank you for being here today, we are extending a special webinar offer of 2 months free of our SEO and telecounseling services with Therapy Sites. So if you'd like to learn more about Therapy Sites and see how we can help attract more new clients to your practice, send us a quick email at webinar@therapysites.com, or feel free to call us at 866-597-2674, and I'll post this information in the chat as well. But we did have a substantial number of questions that came in. So Dr. Stanton, are you ready to dive into some of the questions as well?
Yes, I am ready to go.
Awesome, awesome, awesome. Okay, so let me get to the first one here. All right. Let's see. How do we navigate being insurance providers across multiple states? I'm licensed in Texas for multiple panels.
The idea is that once you become licensed in the new state, well, I think one, if you already have a connection with various insurance panels, sort of figuring out how do you alert them to your new location so that there's already maybe a seamless way to not have to go through a new credentialing process, right? You just have a new location. But that would probably be nuanced based on the different insurance company. So not the most helpful answer, but to think about, you know, what insurance company you really like working with, and maybe starting there, and then saying, okay, I'm licensed in, you know, I'm going to be licensed in this state. What do I do? And hopefully it's just a matter of updating your information and not having to go through another process of credentialing.
Okay. All right. So this one was also on the same topic of insurance company. So has anybody dealt with an insurance company saying you have to have a physical location for people to go to in crisis, like a practice you're associated with or partnered with in the state you are doing telehealth? And then she goes on, or they go on to say, I am virtually seeing a client who lives in Pennsylvania, therefore I need to be associated with a physical counseling practice in the state of Pennsylvania, even though I don't live there.
Well, I haven't run into that, or I haven't necessarily encountered that with, you know, anyone that so far that I've worked with. But, and I don't know if it's that you, like, I guess when they say associated, is it that you're somehow like on the payroll, or is it that
More
you
so
just
that
have,
you'd be, yeah, more so that you'd be able to, like, so if somebody was in crisis, there would be a facility that you could potentially, you know, provide to that person so they could go to it. I'm assuming maybe a hospital or another, you know, practice in the area.
well, and again, if that's something that the insurance company is requiring, then perhaps, you know, sort of thinking of the umbrella, well, what is the physical facility that the insurance company is associated with, and perhaps make that the connection?
Gotcha. Okay. Let's
That is
see.
something to think about too, I guess, to look at the different states to see if that would be required.
Right. Yeah. Question about taxes. So how do taxes work when you are virtually seeing people in different states?
Now that's interesting. So I think it depends on how you're seeing them. So, right, if you're participating in something like SciPac, that might be nuanced differently than if you're actually licensed in that other state. So, and then if you're licensed in that other state, then, you know, whatever the tax requirements are for that particular state, if that makes sense. So there might be like one federal experience, but a few state type of tax requirements that are required.
Okay. All right.
And I say that in terms of like business, right? Like if you have a business in the state, and then, you know, other states, the some of the business taxes are different as well. So that would probably be nuanced by the state.
Okay. Can CEUs count in a given reporting period for more than one state?
Oh, and that's a good question. And I know that this is not helpful, but it is. It depends on the state. Some states are more flexible and just that they have, if it's an APA accredited um, experience and you took the class, then it counts. And I don't know if this question is like, can you sort of double dip, right? If I did this many over here, can I use them over here? And again, I think that it's going to be particular to the state and what they require. But if you're within your window of licensure and renewal, I think that there may be some wiggle room with that. I don't know why they want us to do it over and over again. But they might. I mean, they might. Some states want us to do it over and over again. So you just want to double check.
Right. Kelsey, part of your team, already posted in the chat. There's a code to use for percentage off courses. And one of the questions that came in, will a certificate of attendance, and I'm assuming CE credits, be available for this webinar?
I don't think that we're offering CEUs for this webinar, not at least officially. So again, depending on the state, sometimes there's a few hours of CEUs that can be done in a more informal way, but you just want to double check to see if this would count for that. And on the note of CEUs, I also want to mention certain states have requirements of in-person versus online CEUs, or even including other experiences, attending, conferences, or even participating as, a presenter in various situations can also count in CEU. So to be thoughtful of the state requirements too, how many have to be in person and how many do you have to have?
Okay, perfect. A question came in, does this apply to licensed clinical professional counselors? So I think as you're talking about multi-state licensure and telehealth and some of the topics that you covered today, would that also apply to those folks that are licensed clinical professional counselors as well?
I believe so. I mean, and I think as soon as we become licensed, right, then there's, I think we're all under this umbrella of the avenues to try to have that reciprocity in other states so that you're licensed there as well, or can practice there as well.
Right.
And I would still go to that board, right? Whatever the main avenue for information for that particular license, and see what I say.
And some of the other resources I posted, some of the websites for AAMFT, ASWB, as well as ACA. So that's the American Counseling Association. So that may be something to reference as well. So next question is, I am a new LCSW. I'm currently working for a company in Texas that is getting me a license for Florida for telehealth. The application takes 30 days to process. Am I only able to work with telehealth in Florida through that company, or can I look for employment for telehealth opportunities and other opportunities in Florida in general?
Ooh, now this one I think it depends on. This is the language of the company. Right? Like some folks say, if we do this for you, you can't work with someone else, or maybe there's a time frame. But I think that's kind of the cool thing too about licensure and even credentialing when it comes to insurance panels. You're licensed or you're credentialed essentially through your NPI number, right? So I think that it's you, but there may be some language that the company says, if we paid for this, you have to sort of stick to these rules or something. So double check.
And it may be just something that they signed at time of, joining that group or that practice within Texas or Florida to say that you're required to work only with our with our clients or so forth.
Right. And then it might be too to look in to see how is this, how is the licensing working? If the company has folks in Florida and that's why they focus on you being able to practice there, but maybe there's a way for it to expand, even beyond there. We'll just kind of see what they say.
Let's see. Is there one website that could let MFTs know I'm going to not pronounce it correctly.
Reciprocity.
Between states for telehealth.
So I think in going to I guess depending on the license, right? So if it's, remind me, this is what one again for LMFT?
Yes.
So I think for LMFT, going to the AAMFT website to see what, movement they've made to create this reciprocity experience, and see if there's a way to, like if there's some sort of information. But again, because every state has a different requirement, I would be sort of hesitant to, unless it was like, again, the government website saying this is what it is. I just go to the state and see.
Okay.
So unfortunately, to answer, no, there's not. Now there may seemingly be, right? You might Google this, and there's a place that has put all this information, but I would still maybe use that as a starting point, but then follow up with the official government website to make sure that all
Yeah.
that's legit.
So she references AAMFT, but then says that she hasn't gotten a response. So maybe some hints as to how to maybe interject your question to some of these large organizations and get an actual response from some of them too.
Right, and so one is that it could be the wording, because like I said, not everybody uses the same jargon, right? Reciprocity or licensure through endorsement. I've actually worked with someone who, after one of these webinars, did this whole step and said the same thing. Like I said to Diva, the lady said, "I don't even know what you're talking about," but obviously they have to know because it happens. You know what I mean? Like, so I think just thinking about the way you're asking it, to be clear about, I'm licensed in this state and I would like to practice, or kind of break it down, and then be persistent, right? If that person's not responding to the email, maybe there's a way that you can call or follow up, from another, with another person, if there's, another contact, or just kind of
Yep.
sort of be a cluster person who wants to know.
Yep, exactly. My school was not APA approved. It has limited me when considering moving states. Can you address this as well?
Yes, that it is something that is a challenge for folks that have a degree from a school that's not affiliated with APA. But I think that it doesn't mean that you're totally out. Like some states are, right? They're, nope, we're not going to do it. And okay, but if it's if you're actually trying to move to a state and you really need to be able to be licensed there, I think taking some extra steps for appeal, right, and being able to maybe even connect with your institution and ask them, how in the history of the school have you guys dealt with this when a person is moving to another state? And I'd imagine that they probably have a process, or, some documents and things that they're able to present to help you get through that, to see if there's some way that you can go through like an appeal process.
Okay. So a couple questions in regards to the price, right? How do I, what's kind of the investment for me to become multi-state licensed, or to provide telehealth? Like some of these things, obviously, there's got to be some kind of price associated with them.
Well, I think, but there's the price of, the actual license itself, right? Like every state has an application fee, I should say, that you have to pay for to apply for licensure, and then those annual or biannual, renewal fees. And so that's what I think is important to consider. We don't want to just get licensed in other states just to be licensed if you're not actually, like generating any income, right? So say the renewal is, I don't know, $400 a year, but you don't see anybody in that state, you might kind of want to rethink, is this something that you want to keep putting money into, unless there's actually a plan to grow your practice there. I would consider that also. And then in terms of like PsyPact and some of the avenues to participate in telehealth, there's a few different or organizations, I should say, especially now, after the pandemic, et cetera, that have telehealth services, and they are in a variety of different states. So if you're licensed in another state and you participate in one of these types of programs, many of them are free, because the benefit is that they're able to offer a large number of providers that people have access to. So that's another thing to consider, being a part of maybe one of those, and then adding that you're licensed in multiple states to get folks through that too.
Okay. All right. Let's see. I am outside of the United States for a few months. Can I still provide services via telehealth to those clients in the states I'm licensed in?
I would assume so, but like always, we want to double check the board and see what is specific about how long. I don't think that it's a problem, right? We're allowed to go on vacation and things like that, but I think the time of how long is the thing that you just want to be considerate of. But I imagine as long as those people are where they're supposed to be, then you're okay.
Okay. And then on the reverse of that, if somebody I'm seeing is out of the state, but I'm not licensed in that state, but they're on vacation, or they're visiting a sick relative, I can still consider doing telehealth with them, even though they're not physically in the state with me.
Yes, and again, that's for the most part. I haven't encountered a state that says otherwise, but I'm not the expert on all, states. But that would be just something that, again, based on the timing, right? If someone's just on vacation, I don't think that it's in the best interest to terminate their services. I mean, that's just, that doesn't seem like best practices in the best interest of the person. So I think it's
Right.
just how long that will be. And then where is their residence, and like where's their residence and how long are they away from that to essentially be considered a resident somewhere else.
Okay. And then a question came in. So, any thoughts or knowledge of the telehealth waiver that is set to expire in September, where behavioral health providers will have to see patients in person every 6 months? And I don't know if
Uh,
that's something that's changing in the industry.
I think that might be like a per state sort of situation.
Okay.
Um, and so if that is happening in your state, then you might then look to see if your state participates in something like SIPAC, so that then you can, apply to become a part of that to then continue that telehealth experience with other folks,
Okay.
or even the ones in your state.
Gotcha. And a couple of respondents here are saying Congress has to rule on that. It is national. So maybe a couple other people chiming in
Well,
and maybe
I haven't
Senate.
seen it. Nobody told me I had to do that yet, so I'm gonna go
Um,
and ask for forgiveness instead of permission, I guess, right? Yeah.
um,
But that
yeah,
is something, I guess, to take note of. Now, don't be afraid of that, guys. Like, I don't want us to start getting all like, oh my gosh, all these big changes, because who knows what will happen. But for right now, I guess just kind of keeping an eye on that if it is going to impact things. And then also considering how many people do you see telehealth, right? Because maybe it's not that big of a deal. And for some, it may be, because I know some people, their entire practice is telehealth. So, and one note about that, if say that happens and we have to see someone once every 6 months, rather than thinking, oh gosh, now I got to get an office space and go through all that. Maybe, right? Maybe that's a collective effort with you and some other mental health professionals to get a
mhm,
place and kind of rent something out together. But then also there's a lot of like workspaces that I'm seeing around that are popping up where you can like essentially like rent out a space for a short period of time, right? So maybe once a month you have this space and you schedule everybody to come in person, and that's that.
mhm. So a couple questions came in regards to what about interstate compact? So asking about what about counseling compact? What about therapist compact? And kind of just going down that road of maybe the individual certifications and things like that.
Right, and so that's where those other organizations like AAMFT and I'll probably get the letters wrong myself too, but the social work boards,
Yep.
they're working to create that type of compact
Okay.
so that it's available at all the different licensure
Okay.
levels or
Okay.
titles.
And when you were asked earlier if, for the folks that were on the call, if, you want to learn about telehealth and you want to learn about multi-state licensure, are there some states that basically say you can only be licensed in this state and that we don't want you to be licensed in others?
I haven't seen anything in that way where
Okay.
from it's more so there's language about practicing in other states. Like there's certain like if you're licensed in California, there's language about you can practice for so long, you know what I mean, before you're
Uh-huh.
in violation of your license here in California, right?
Okay.
And then but then also I think the big thing is that the state that you want to apply to is accepting of you. I don't think California will care, right, if I
Hmm.
have a license in another state, as long as I meet those requirements as well.
Okay. Yeah. And I'm sure that there, like somebody had responded saying New York is kind of tricky. I'm sure there are some states that are maybe a little bit more strict in their requirements than others,
Right.
maybe. Yeah. Let's see. So again, another question on taxes. So with taxes, if you are licensed in multiple states, you will pay state tax of the state in which you live in or list as your primary residence. So that's interesting.
And I would say, yeah, take that up with your
Yeah.
accountant, your CPA, because it may vary um, depending on, yeah, just how that works out.
Okay. All right. Let's see. Working with a patient that is not physically located in a state that you're not that you're licensed in. Been told that's a big no-no. So obviously making sure that if you're working with someone that you know that you're licensed in the state that they reside.
Exactly. Yeah, their residency is important. And that's when we say physically located, that's a little nuance too, because that's where, again, the person may be on vacation for 2 weeks or for a month and they're coming,
Hmm.
that sort of just depends. Now, if they're going to be gone for 3 years and take on a new life in another state, then we're
Yeah.
probably going to have to make a transition to new
Okay.
care.
All right. Other question was, what's the easiest way to get CEUs for various states?
Oh, that's a good one. So there's some websites, there's some organizations that offer CEUs, and then you're able. And I don't want to advertise anybody, but just do a little research online.
Yep.
And then there are websites that will give you the option of like selecting what your state is, and then what your license type is, and then they have like a list of what the requirements are, right? So I think that's pretty cool for the people to know what we're supposed to have depending on the state. And then, so if you're using one of those kind of websites, I imagine then, you just go through each of your different states and complete the requirements that way.
Yeah. All right. Let's see. We got a couple other ones coming in here. Um, if you're not licensed in a vacationing state, you may be able to see them if you contact the state and get a short 30-day allowance, for example. So good point.
Mm-hmm. And that's right. So depending on how, like if you're there, yeah, if you go on vacation for a period of time, it always depends on how long it is, and then what the state says about how long you're able to practice with it without.
Yeah. All right. Let me see if I missed anything here. I feel like we got to most of these. Um, yeah, I mean, just really a couple of questions in regards to, making sure that you're licensed in the state that you're seeing somebody, and even if you're
Yes.
on vacation, as long as it's not long term, you can
Yes.
still see the people. So a couple follow-up questions there. Um, but
And
other
just
than,
about that too, the whole idea is that I guess it's in the spirit of the protection of the public, right?
mhm,
So if that person isn't a resident in the state that we're licensed in, then that board, right, the California Board of Psychology, can't protect that person from me if I do
mhm,
something crazy, right? If that person isn't essentially a resident of the state. So
yeah,
that's something to just think about, right? Like, how does the board protect the public if I do this or if I do that?
yeah, exactly, exactly. All right, so we're almost at the top of the hour. I think we got to almost all the questions. Again, Dr. Stanton, thank you so much. I mean, I know that you're super knowledgeable about this topic, and I know you've done a couple of webinars for us in the past. So thank you again for, dedicating your time and providing the webinar for today. We really appreciate it more than you know, and I know all the attendees appreciate you answering all their questions. There will be a recording of the session, so that will be available, which you'll be able to hear and see the slides that you need. And then we also posted some of the special offers for attendees, so you can see those as well. But if you have any questions, obviously feel free to reach out to AATBS or to Therapy Sites if you have any questions for us. But again, thank you guys so much for attending. Dr. Stanton, again, thank you and your
Thank
team for
you.
participating.
Thank you. This was great.
Everybody have a great rest of the afternoon. And again, thank you so much for joining us today, okay? All right, bye-bye.